The mission of City of Hope is unfolding in Orange County. As one of only 51 comprehensive cancer centers in the nation, we're setting the gold standard for cancer research and treatment. More than 1,000 physicians and scientists transform discoveries and treatments and cures, benefiting 100 million people every year. Now we're making our life-saving expertise readily accessible to you, your family, your neighbors, and all our friends right here in Orange County, because our patients are calling us.
I go at least monthly to Duarte. That drive could be 2 hours, depending on traffic. And I'm very excited to see City of Hope come to Orange County.
Like Susie, nearly 20% of Orange County residents diagnosed with cancer leave the area to get advanced care. Together with philanthropists, corporations, healthcare partners, patients, and the community, we're building a county-wide network of cancer care that includes an 11-acre cancer campus of the future in the Great Park neighborhood of Irvine. Construction has started on a 190,000 square foot cancer center opening in 2022. In addition, construction will begin on Orange County's only specialty hospital focused solely on cancer this year. Right in our own neighborhood, we bring a clinical research center home to a vast number of phase 1 through 3 clinical trials speeding promising treatments to patients years before they become standard of care. Renowned surgical, radiation, and medical oncologists with unique expertise in your specific cancer type. New ways to prevent and target cancer in its earliest stages with precision, using genomic and genetic profiling, ensuring patients receive the right diagnosis and treatment from the start.
We've got a team of experts that focuses on rare cancers, common cancers, and is able to focus on each specific patient's individual tumor.
Here, speed is a life-saving element where philanthropy holds tremendous power. Your partnership will help us accelerate this bold undertaking.
I hope that when people drive by this campus or see it from the freeway or maybe even get off the train, that they see this as a beacon of hope, that no matter where they are, whether they're in Huntington Beach or Santa Ana or San Clemente or here in Irvine, that they see this as their place, that they see this as a place of hope and healing.
City of Hope is delivering tomorrow's cures to patients who need them today, because hope lives here in Orange County.
Good afternoon, and welcome to the South Orange County Economic Coalition's January virtual membership meeting to a healthier South Orange County in 2022. I'm Mike Balsamo from Rancho Mission Viejo, proud to be the chairman of the South Orange County Economic Coalition. Before we get started, I'd like to thank our all-star sponsors who made this program today possible. First, I'd like to thank our title sponsor, City of Hope, Orange County. City of Hope is advancing world-renowned cancer treatment and research by establishing a National Cancer Institute designated campus in Orange County. They have over 400 physician specialists and 1,000 scientists and researchers focused on only one thing, ending cancer. City of Hope offers nearly 1,000 clinical trials each year and breakthrough treatment options, all delivered by a compassionate team of experts who take your hand and never let go. You can learn more at cityofhope.org/OC. I'd also like to thank our program sponsors, Cigna, Memorial Care, and UCI Health. As a global health service company, Cigna's mission is to improve the health, well-being, and peace of mind of those they serve by making healthcare simple, affordable, and predictable. Memorial Care is a nonprofit integrated health system that includes 4 hospitals, including South Orange County's own Saddleback Medical Center, as well as 2 award-winning medical groups, imaging centers, surgical centers, and much more. Memorial Care has the teams, tools, and know-how to support you every step of the way. And UCI Health, Orange County's only academic health system and National Cancer Institute designated comprehensive cancer center. UCI Health is dedicated to improving the lives of people in our community and beyond through clinical innovation in primary and complex care, treatments rooted in scientific discovery and a commitment to world-class clinical care. We also thank our supporting sponsor, Providence Mission Hospital. With 2 locations in Mission Viejo and Laguna Beach, Mission Hospital offers a wide range of medical specialties and subspecialties with an unparalleled standard of care. Their dedication to service, compassion, and quality health care has made them an essential caretaker of the South Orange County community for over 60 years, and the #1 ranked hospital in Orange County by Newsweek and South Orange County by U.S. News and World Report. Now please join me in welcoming our 2 moderators for today's program. Annette Walker is president of City of Hope, Orange County. She is a visionary healthcare leader, chosen to build a 21st century comprehensive cancer campus and network of advanced cancer care in Orange County for the City of Hope, one of the nation's elite cancer treatment and research centers. A national leader with local influence, Annette was twice recognized as one of the most influential leaders in U.S. healthcare by Modern Healthcare, the industry's leading source of healthcare business and policy news, research, and information. She has been at the helm of many top healthcare organizations, but considers her leadership at City of Hope among her most important roles. In expanding City of Hope to Orange County and delivering a world-class cancer center and regional network of care, she is serving the 3.2 million people of OC, her home for more than 40 years. Also moderating today is Seth Teagan, the Chief Executive of Providence Mission Hospital. In this important role, Seth is responsible for driving Providence Mission's success as the premier healthcare provider in South Orange County through the growth of high-quality clinical services and delivering an exceptional patient experience. He oversees all aspects of acute care services at the Mission Viejo and Laguna Beach hospital campuses, as well as Providence Mission's clinics, ambulatory centers, and other associated business lines. Seth passionately serves on the board of directors for the South Orange County Economic Coalition and is an engaged member of Southern California Hospital Association, American College of Healthcare Executives, and the Healthcare Executives of Southern California chapter. While Seth takes incredible pride in his work, he says his greatest accomplishment is his family. Seth and his wife, Nicole, have 2 young boys who share his passion for golf and Wisconsin Badger sports. Seth, Annette, the floor is yours.
Thank you so much, Mike. It's great to be here. And we so appreciate the opportunity to talk about some of the biggest health challenges that are facing our community. We are fortunate today to have an all-star panel with some of the top physicians in healthcare and some of the top leaders, not only in Orange County, but all of Southern California.
That's right, Annette. Let me start by introducing our first group of panelists. Dr. Ed Kim, Physician-in-Chief at City of Hope, Orange County, and Vice Physician-in-Chief at City of Hope National Medical Center. Dr. Kim is a renowned physician, executive, and cancer clinician and researcher. He was also recently honored as one of the nation's top advocates by Modern Healthcare for expanding access to life-saving clinical trials. Dr. Jim Keeney, my personal friend from Mission Hospital. He's the managing partner of our emergency medicine group and one of our physicians in our emergency room at Providence Mission Hospital. And Dr. Sebastian Schubel, the medical director of operations of UCI Health. Thank you all for joining us today on this panel. Well, let's jump right into it, Annette. Would you like to lead?
Yeah, great. Thank you, Seth. I know none of us would have believed that this was going to be starting year 3 of COVID. And, we got through the initial wave, we got through Delta, now we're in Omicron. And what do we need to know about this new variant? Dr. Kinney, it's great to see you again. I know you're on the front lines of this, you and your group. So what do people in our community really need to know about what's going on right now?
Well, I think people are pretty familiar at this point with the whole COVID situation, right? We had Delta last year about the same time. It seems like a redo of last year for the most part. There are people out there that believe that because this is more mild, that maybe, why don't I just catch it and get it over with? I don't think that's a good approach because a certain percentage of people, especially the ones we see, end up in the intensive care unit. They end up hospitalized for prolonged periods of time. Now, those people are getting better at a slightly faster rate, and they're getting better overall. So it is a more mild disease, but still a very serious disease that you want to avoid if you can. Best way to avoid it would be vaccination is a great way. And then, if you're more than 6 months out, getting a booster, because it does lose efficacy, especially the Johnson & Johnson. It goes down to about 15% efficacy after 6 months. So you'll definitely want to get boosted. Still, the state has a mandate for masks inside buildings, and I would do that. Avoid large crowds, and wash your hands real frequently. Interestingly, I think all these approaches that we're taking are reducing other infectious diseases, so we're not seeing as much as influenza and RSV. Thank goodness.
Jim, just one thing that I hear a lot of confusion in the neighborhood, not at work so much, but how do you know when you really should go to the ER? Because that's where I hear that our ERs are sometimes getting stopped up with people who should be there and some who maybe shouldn't be there. So how do you really know if you should be going?
Yeah, that's a great question, because in the past, what I've said is, look, if you think you need to come to the emergency room, don't do this yourself. You don't have to be your own doctor. Come to the emergency room and we'll figure it out for you. If you don't need to be there, we'll tell you that and we can send you on your way reassured, right? It's not typically up to the average person just to do their own healthcare. In this situation, though, this is unique. We are in crisis and this is different. So I would raise that threshold and really think about other opportunities. Like, are there urgent cares you could talk to? Do you have a primary care doctor? Do you have a family member that happens to be real good at these things that you could ask their advice as far as what to do, how to take care of yourself? The people that I think should immediately come to the emergency department are when you're having significant trouble breathing. I mean, a lot of people now have those Apple Watches or other watches that give you a pulse ox. People can buy pulse oxes online. If your oxygen level is low, absolutely, you need to be there. If you're working very hard to breathe, you need to be there. If you're having significant pain, with Omicron, we're actually seeing vomiting as part of it too. So if you can't hold down fluids or you're having gastrointestinal symptoms that don't allow you to take in adequate nutrition, you should come into the emergency department. But at this stage, unfortunately, I hate to say, you should try and avoid coming to the emergency department at all costs if you can.
Dr. Schubel, what are your thoughts and what are you seeing at UCI?
Well, what a start to 2022, right? I couldn't agree more. Nobody thought we would be doing 3 years of this. And the Omicron variant has certainly been in the news. It's been an interesting experience working here at UCI. We're inundated like most of the other hospitals, actually, I would say in the country, if not the world. I think there's some bad news around Omicron. It's incredibly contagious. It definitely leads to breakthrough infections for people who have already had a COVID infection or who have been vaccinated. But there's good news too. Those breakthrough infections tend to be very mild. The virus itself appears to be significantly milder than Delta was. Of course, if it's half as severe, but 5 times as many people get it, you're still going to have an inundated healthcare system, which is what we're really working hard right now to avoid. I think there's some other good news too. We have a monoclonal antibody that's fairly effective. Remdesivir, an antiviral infusion, is still very effective even against Omicron. And now we have Paxlovid, an oral medication that your primary care physician can give you that looks to be able to reduce the risk of hospitalization even for unvaccinated patients by as much as 90%. So we have a lot more arrows in our quiver. UCI Health, last year, we initiated 35 COVID-related clinical trials. We're learning a lot more as a community on how to manage this disease. We're working together as a group. I think all of us in Orange County communicate with incredible frequency to try to tackle this as a team. And I think that we're in a much better place than we were certainly a year ago. But I absolutely agree with Dr. Keeney. The more people that we can get vaccinated and boosted, the more people can avoid high risk, high transmission environments, the better we'll get through January. And if we're lucky, this might be the storm before the calm. Because of the characteristics of this virus, we might find ourselves in February or March in a really strong position.
That's great. This is just a question you might elaborate on a little bit. I've heard in the news the use of pandemic versus endemic. Is that what you're referring to when you say maybe it's the storm before the calm?
Yeah, I think so. I'm not an epidemiologist, I'm not a virologist, but I do get the opportunity to speak to people who do that kind of work for a living. And I think the prevailing thinking is that COVID is probably going to be a virus that is not going to vanish. It's going to become, as you say, endemic. It's going to be part of sort of the human experience. The question is, how can we mitigate the worst effects of a virus that is this transmissible? And I think some of the things that we've done, some of the things the medical community has been able to do over the course of the last year has really made some inroads on creating a situation where we might be able to live with COVID.
Well, thanks, Sebastian and Annette. I'm going to pivot here a little bit on the COVID topic. So COVID's proven to have a particularly devastating impact on those who have compromised immune systems. And as we know, those undergoing chemotherapy or other cancer treatments often have impacted immune systems. So Dr. Kim, from your perspective as the physician-in-chief of City of Hope, what have you seen the impact to be for these patients?
Yeah, thanks, Seth. And it's an honor to share the panel with both Jim and Sebastian, and appreciate both you and Annette taking the time. You know, as an oncologist, we know that the cancer population, the patients who are either diagnosed with cancer, undergoing treatment, they have treatments that can compromise their immune systems and make them weaker. And whether we're in a pandemic now or it was previous years, we've always taken such high vigilance with those folks. I know if any of us pre-pandemic saw someone walking around with a face mask in public, you automatically thought they were a patient who had cancer or were battling cancer. Now we can't tell each other apart, which I think is a good thing because it is helping keep everyone safe with these measures, and certainly our most vulnerable populations. A couple things that we always are very vigilant about: hand washing, exposures, being in ventilated areas. And in the winter months, our patients who are on therapies, chemotherapies, they're used to having to hunker down, not be out as socially as they should. The number of questions I used to get pre-pandemic from my patients who, can I go spend Christmas with my kids? Are the kids gonna make me sick? Because they're the ones who brought the germs home from school and others. And the advice we always gave them was, look, if someone has had exposure or is having symptoms, just have them in another part of the house. Don't, no big hugs, no big kisses, but you can still see them. And this now is obviously much more important as we have a new variant and high transmissibility, as both Jim and Sebastian have pointed out. For patients who have completed treatment, their immune systems do come back close to normal, but there's always a risk, right? That susceptibility that they've had a history of treatment and cancer, and they are at a little higher risk of that. The thing I'll really hit home with is that cancer diagnoses are not stopping. Right? People are a little scared now to come in and get their screening tests because of not wanting to come to the doctors. We're going to see this rebound effect where people will be diagnosed with higher stages because we missed a couple years of screening tests. And that's going to change our treatments, our diagnoses, and the outcomes for folks. So I still encourage people to come in, get their screenings done. We have telehealth and other technologies to use. City of Hope is working on developing a vaccine that will target COVID. So innovation doesn't stop either. We have to keep fighting this disease. And the biggest crisis, in addition to the risk to our patients, has been our workforce, right? Our frontline staff have been just working day and night tirelessly, and it's been very tough on them. And I think we have to continue, just because we're not hearing about it in the news as much and others, we have to continue to reinforce that these are the folks who are putting in the time and efforts. Bastian, your folks in the emergency room, Jim, your folks on the front line, our nurses, our paramedics, our MAs, all the folks who are trying to make this happen. And we really appreciate their efforts.
Great answer. Thank you, Ed.
Okay, let's take a question from the audience.
Hello, I was wondering, what tips do you have for us to help us maintain our health during this pandemic that never seems to end?
Wow, that's a great question. Sebastian, you want to start? Let's run around the room. Let's each physician give us their perspective on this.
Sure, happy to, Annette. I think Ed already touched on this. There's a lot of elements of healthcare that COVID really kind of elbowed out of the way. Cancer doesn't know that there is a virus floating around the world. Heart disease, stroke. There's a polyp growing in someone's colon right now that someone may not have gone to get their screening colonoscopy to evaluate. There is a huge backlog of healthcare that is getting pushed further and further out, and the acuity and severity of some of those illnesses is only going to get worse over time. So But what I would encourage everyone is go to your primary care doctor. Don't delay seeing your dentist. Get your screening colonoscopy. Go to your cardiology appointment. The maintenance of our health is critical. And I know that right now everybody is focused on this pandemic, and rightly so. It's killed nearly 1 million Americans. But that doesn't mean that the rest of healthcare can stop. And so we still need to do the things that keep all of us, keep our family members, keep our friends, keep our colleagues healthy.
Jim, you want to share your thoughts?
Sure, I think those are great points. A lot of people are neglecting their healthcare at this point. They're just hunkering down. And so don't neglect your healthcare. Personally, though, I think you can, do your own work to try and stay healthy, right? Don't forget, we're not going to the gym as much either anymore because of the public spaces issues that come up and go away. And I know I've gotten out of my routine, but you can continue to get exercise regularly, eat healthy. And all those things mom told you: get enough sleep, eat healthy, avoid stress, get regular exercise. Let's not forget the basics there, and just take care of yourself. Also the mental health side of things. Make sure that you have a way to deal with stress management and stress relief, and possibly have someone to talk to about that, whether it be someone close to you or a mental health professional. But just be sure to take care of yourself during this time. It's a tough thing, and we're constantly reminding each other in the healthcare workforce to do exactly that, because we need to be there when people need us, and we're just trying to do self-care for a lot of this time.
Those are some great pointers about not only the screenings, but just don't lose your routines. I've heard the average weight gain over COVID was like 10 to 15 pounds or something. That it's not good for us. Ed, is there anything else you wanted to add to the good advice that we already got?
You promised you wouldn't share how much weight I gained over the pandemic, but okay. I think both Jim and Sebastian had some great points. And, I think to the point about the dentist, which I recently went, and, it's not the most anxious place I like to go for sure. But if someone's gone out to dinner, they can certainly go to the dentist. Right. The risk exposure is very different. Then going outside is a great way to do it. I believe in ventilation and spacing. So if outdoors is a great place, especially in Southern California, to do that. We're very privileged with the weather we have down here. So there's no excuses about that. I think I'll look forward to some of the statistics we'll see once we get through this pandemic of the record number of people who adopted pets or, downloaded streaming video or, took up golf. So I think those are the numbers that I think will be there. But find a hobby, stay connected, go outside. There are a lot of ways to do things. And like I said, some of us didn't get out of our routine. Some of us have still yet to get a routine and exercise. So that's going to be one of my New Year's goals.
That's great. Thank you. Seth, I think you had some questions you wanted to ask.
Yeah, thanks, Annette, and great answers, guys. And I think it's a wonderful segue into our next question, which is about whole person care. All those things that you just mentioned are how we take care of ourselves, which means confronting some of our biggest mental health and substance abuse concerns as well. So let's talk about the opioid crisis that impacts Orange County and the nation. Dr. Keeney, what proactive approaches can families take to protect their loved ones during this time?
Yeah, that's a great topic to bring up because, a lot of people think that, we live in a relatively affluent area and that somehow this problem is isolated to inner cities or poverty areas, and nothing could be further from the truth. A lot of drug use results from, free time and excess cash often. But I think overall, to answer your question, what can we do to try and bring this under control and reduce the problem? In a lot of other countries, you get a knee replacement and all you're going to get for pain medication is non-steroidal anti-inflammatory. You will not get narcotics. Here in the United States, we do tend to give narcotics more freely. Now, when I started practicing, it was reserved for the cancer patient, for the person who is in extreme pain, anyone who's near the end of their life for sure, just trying to keep people comfortable. But over the last 3 decades or so, it's really expanded. And people also expect their pain to be controlled until they're fully recovered. So, I mean, I think if a doctor tries to give you more than a 3-day supply of narcotics, you got to think about how that's going to affect you. And if you have any leftovers, how that's going to affect your family, having that in the house. So access, you actually want to limit that. We've encouraged doctors to try and only write for the minimal supply necessary of narcotics. People are treating mental health with these type of things. And so rather than bury your unhappiness, sadness, anxiety, stress, depression with opioids and other dysfunctional ways to manage it, I would recommend seeking a mental health professional. And that can avoid a lot of these unnecessary coping mechanisms and using narcotics inappropriately. Families, again, access, avoiding that access. Don't keep excess narcotics in the medicine cabinet. When your kids start using this stuff, that's the first place they go. They dig through there. There's parties called mixers where all the kids grab the bottles from their parents' medicine cabinet, throw them in a bowl, mix them around, and then all the kids take turns taking pills to see what happens. You don't want your kid involved in that kind of thing. Again, being present with your kid, making sure that you're aware of their social life, online and offline, their friends, their disposition, who are they hanging out with. Those can give you a lot of early clues, so you can recognize this early. I think that's about all the recommendations I have on that.
Thanks, Jim. Really making us all feel upbeat with all that. I have great news for the panel. Raising a young family myself here in South Orange County, I have neither a lot of extra time nor a lot of extra money. So I'm personally worried about myself. Though I do worry about kids in our community. My boys are 10 and 9, and hearing your responses, I mean, that's one of the things I think about every day. So Dr. Schubel, would love your thoughts on this topic as well. Where else can people turn if they need help dealing with some of these issues at home or in life?
Yeah, I had not heard of a mixer. I'm a dad too. I've got 2 boys as well, just like Seth does. And the kind of mixers I went to when I was growing up really had nothing to do with what you just described. It is a little bit frightening. But the COVID pandemic has also had a bit of a shadow pandemic around mental health issues. That's just been an undercurrent. I think that we're only now really starting to recognize how severe it's been. And a big part of that is that the opioid crisis, which was already well entrenched, seems to have really spiked in the last year or 2. I think there's lots of areas in the country where opiate deaths are hitting new record highs. There is an organization here in Orange County. It's called SAFER RxOC. It's actually a collaborative group that all of the healthcare systems in Orange County are partners in UCI, a big part of it. It's a wonderful organization that really focuses on 4 different elements of this crisis. The first is what Jim already described, which is safe prescribing practices by physicians and safe disposal of medications if there is an excess in the home. And the best way to get rid of those really is to bring them right back to the pharmacy where you got it, or any pharmacy. The second arm of what they do is what they're focused on right now is treatment. It's immediate, rapid access to a opiate navigator, which you can reach right through their website, which is saferrxoc.org. They will help you get your hands on what you need, whether that's Suboxone or methadone, mental health treatment. They'll get you an appointment almost immediately with a mental health specialist to help you, your family member, get the mental health care that they need to get through this. The third, almost equally important element is the reduction in the stigma around this. There's an awful lot of people who confuse opiate abuse with just a slip up or someone who has a character defect. This is a mental health issue just like anything else. These are powerful, powerful drugs that even a small amount of exposure can lead to a very rapid onset of addiction. And the last thing they do is harm reduction, where they're really trying to avoid people passing bloodborne illnesses to each other. There's needle exchanges in Orange County and other elements like that. So if I were to give any advice on this at all, I'd say if you have a family member that you think might be struggling with this, if you're personally struggling with this, go to saferrxoc.org, contact that group, and they will point you in the right direction.
Great answers. I'll turn it back to you, Annette.
Yeah, I know you guys touched a little bit on some of the issues with getting ourselves out there, but I know when you're in the emergency room, you guys have the opportunity to see some pretty crazy things that that happen to people. And, people in Orange County, many of them are very active in sports, biking, hiking, those kinds of activities. So Dr. Kinney, you in the emergency room, I'm sure you see head trauma and some of the issues. Can you talk a little bit again about making sure our community understands the importance of protecting yourself from head trauma in the various activities that people participate in locally?
Sure. Yeah, I mean, as a trauma center, both at Mission Hospital and at UCI, we do see quite a bit of head trauma. That's a frequent occurrence, and usually associated with a lot of any other trauma. We may see head trauma in addition. So when you're talking about especially sports, kids on anything with wheels, should have helmets. Absolutely, adults as well. So the problem is if you're going to tell your kid they have to wear a helmet and then you go off and you're not wearing a helmet, they get the message loud and clear that they don't really need it. So I think it really what's good for the goose is good for the gander kind of thing, where you gotta set an example. Wear a helmet while you're on anything with wheels at all, as well as snowboarding. A lot of the mountains now require helmets when you're snowboarding. I think that's an awesome idea to have one of those on. I personally have had a pretty significant head injury with my helmet on that I walked away from, and nothing severe, at least that I know of. And that could have been a disaster if I didn't have my helmet on. So I very much appreciate that. Motorcycles as well. That's a common area where we see a lot of head trauma. So just be sure that you're taking the proper precautions to protect yourself against head injury.
Those are great suggestions. I hadn't thought about, I do see parents sometimes that their kids got the helmet on, but they don't. It's a nuance that, of course, do as I say, not as I do. So very, very good advice. Sebastian, do you have anything to add to that?
Yeah, prevention is the key here. I am on the ICU service right now. I rounded this morning in our trauma ICU, about a dozen patients up there that I'm responsible for, and an awful lot of them have really bad head injuries, and a lot of those injuries are difficult to recover from. Another thing that COVID has sort of shaken out, which surprised me a little bit, is in the last few months, it's going almost back to the fall of last year, we've seen the highest trauma volume that we have ever had at UCI by a significant margin, 20 to 30% increase in trauma activations for our level 1 trauma center. And I think, Jim, correct me if I'm wrong, but I think Mission in South County is actually the busiest level 2 trauma center in the entire country by activation volume.
Wow.
So we have some really phenomenal trauma centers here in the community, and UCI has responded. We just hired our 11th trauma surgeon, and we just opened up a salary line to hire a 12th just in the next couple of months. Having 12 trauma surgeons at a single institution, that's a very large group. And so we're doing the best we can. We keep the trauma center open 99% of the time, and we're able to absorb that volume. But boy, it would really help if folks could be as careful as possible out there. And just like Jim said, if you're on something with wheels, please put a helmet on your head.
I have to say that statistics really surprises me, because I would have thought during COVID, when people were more, sequestered, at least to some degree, we would have seen less. That's a little troubling. But
it went down at first. Back when the whole pandemic started, we definitely saw significant people who were just staying home, not doing much. Bars were closed, so that always helps a little bit. But there was backlash there too, and it has been unrelenting for several months in a row now. So we've corrected, and we're able to absorb that. But I do worry about my community a little bit.
Well, thank you. As a member of the community, I can't tell you how good I feel that Orange County does have the trauma system it has, and I hope to God I never need it. But it is, I've seen it in action, and it is life-saving capabilities we have here. So thank you.
And then let me add one more thing on the head trauma issue, if you don't mind.
Sure.
So one other thing that I forgot to mention was e-bikes, and alcohol. It's a really common combination. I think a lot of people believe that they don't get a DUI when they're on an e-bike and they are intoxicated. And a lot of adults, like we said, don't wear helmets. And so we're seeing a massive increase in the number of e-bike injuries associated with head trauma. So again, if you're on something with wheels, that should not be associated with alcohol. And definitely wear that helmet if you're an adult on an e-bike.
Wow, great advice. Thank you.
Yeah, great advice, Jim. And thanks, Annette and Sebastian. Great answers there. We're going to pivot here a little bit just on in terms of topics. And the next question we have is for Dr. Kim. So it's exciting that the City of Hope will soon be joining the Leonard Foundation Cancer Center. Let us tell us a little bit about that and what it means for the local community in terms of cancer care.
Yeah, I will state that my wife won't let me get an e-bike first. So just for that reason, Jim, we're really excited about bringing this Lennar Foundation Cancer Center and the campus we're building for subspecialty care in cancer. It's something that City of Hope does. It's what we do, as Sebastian talked about. He's hired his, I think he said 11th or 12th trauma specialist. That's how we are with cancer. We have a deep bench. Myself, I specialize in lung cancers. Don't send me people with breast cancer, colon. We have specialists who deal with that, and hundreds more that exist in the City of Hope enterprise system. So leveraging, expertise is really important. I think there's a perception that places like City of Hope, who are just specialized in cancer, that's where you go if stuff doesn't work. And frankly, having worked in systems that are both, have cancer as one of the components and cancer as the component, getting an opinion and just hearing another opinion from an expert is always worthwhile. You just have to think about that before you begin that journey of diagnosis, treatment. Cancer has become very complex. Even lung cancer, as I've watched it evolve from 2000 when I started, I could have taught my daughter how to treat lung cancer at that time, and it's not very sophisticated. Now, if I don't keep up reading the literature, I miss the biomarker that's been approved yesterday or the new oral therapy that's approved tomorrow. It's amazing how much smarter with genomics that we've become. So I think it means a lot for the community. It means that we have more partners and collaborators in the community. We all are fighting the same battle. That's to help people get healthier, help them cure cancer. And we look forward to being part of the Orange County community and adding whatever we can to help the 3+ million folks in Orange County.
Yeah, and I know research at the City of Hope is certainly kind of one of the flagship components to your program nationally. You want to talk just a little bit about the research innovations that you folks are working on and how that's going to benefit really Orange County in totality in terms of access to some of those innovations?
I tell you, I've been with City of Hope now for a little over a year, and I moved here 6 months ago. It's been amazing to see what types of research and innovation that City of Hope has accomplished. Synthetic insulin is one of the inventions that originated in a basic science lab and has now treated hundreds of millions of people across the world. And that was born and bred out of City of Hope's laboratories through their GMP facilities and into the public. We've seen this also with antibody platforms, with monoclonal antibodies, CAR T therapies. And so 4 or 5 major drugs and platforms have come out of innovations of City of Hope. And I really haven't seen institutions in cancer that have been able to utilize the strength of their basic science research, take it through the clinical trials, and then produce with a facility to get those drugs to market. And that's what's really innovative. The early phase development program using precision medicine, we hope to bring new drugs, first in human, first in the world, to not only what City of Hope is doing, but also to Orange County. And this is really what makes it exciting. These types of innovations where we see things like COVID and we want to invent a vaccine, which is currently in our clinical trials ongoing right now. This is what makes it exciting. There's thousands of experts throughout our enterprise that are working on these problems concerning cancer, and diabetes every day. And we hope that we can help not only treat people, but also try and prevent the cancers from occurring. And that's the next step with precision prevention and other aspects. So I view the research, the trials, these are opportunities. These are hope for patients. And there is standard therapy. It's gotten better. But the only way we get new standard therapy is through clinical trials and research. And that is really something we eat, live, and breathe every day.
Thanks, Ed. We're excited to have you as part of our Orange County healthcare family now. Annette, I'm going to turn it back over to you.
Thanks, Seth. And, I want to thank everybody for participating today, but I have a last question for the three of you. Each of you were able to bring to light some really amazing things that our organizations are doing. But I sometimes wonder, as one of the healthcare leaders in this industry, how can we partner to even make a bigger impact on this community? How do we work together? So if you could only do one thing, what would the thing be that you would want to do that would make Orange County a healthier place? So let's start with Jim and finish with Ed, then with Sebastian.
What I would do, since I work in the emergency department, I tend to see the people who don't have access to healthcare. I tend to see people that could have been treated earlier and are now in a complex situation because they couldn't receive the medical care they needed. I send people home that bounce back to the emergency department because they have nowhere to go once they leave the emergency department. So if I were to do one thing for the county, it would be to improve access, to create more avenues for people to be able to get healthcare.
That's absolutely, you're correct. That is a bigger challenge than many people realize. Thank you. Ed, how about you?
Well, I love Jim's answer, and maybe he saw my notes ahead of time, but I have to echo that. As pointed out, one of the passions I've had is trying to bring access to trial opportunities for patients, and that you shouldn't have to travel long distances to seek expertise care or clinical trial opportunities. So that's something we're working on at City of Hope, to bring clinical trials opportunities, precision medicine. As an NCI designated center, I feel like that's our job, to bring this type of expertise to the local communities where people live in the underserved areas. And I think that that access theme that Jim brought up is certainly something that resonates very much with what I feel.
Great, thank you, Ed. Sebastian?
I absolutely welcome. I'm so excited about what's happening in Orange County right now and in the coming years. I think the very nature of people that do healthcare, physicians, nurses, everyone that works in healthcare, is to be unbelievably collaborative. We love talking to each other, working with each other, teaming up. And the last few years of this pandemic, we've seen the health systems in Orange County do exactly that on a system level. And we've seen right down to the personal and individual level, people do the same thing. I did my training in New York City, and I stayed and worked there for a while. I trained in New York Presbyterian at the Cornell campus. And right across the street from that academic medical center and medical school, literally across the street, is Memorial Sloan Kettering Cancer Center. That proximity, what one would think might actually create competition, in no way did, because it created collaboration, it created growth, it created a real environment for patients to get the best possible care and for physicians to learn from each other. The changes we're seeing in Orange County now are so critical. Our community does not need to continue to leave the county to get the best possible health care. City of Hope is contributing to that. Mission Hospital System, Providence is contributing to that. All of the players here in the county are contributing to that. And we're building this pretty new hospital that's right behind me, that's going to open up in 2025 and add much needed beds to the Orange County healthcare community. Keep in mind, California has the second lowest number of licensed hospital beds of any state in the United States. We, if we were a country, would be the 5th largest economy in the world, and yet we don't have enough hospital beds to actually take care of our citizens. That needs to change. So I think the evolution of Orange County's healthcare environment, with adding these facilities, bringing new players into the game, building these new hospitals, and the explosion of telehealth and virtual care options, We do 7,000 telehealth visits a month now. We've got a dispatch health program where we can do urgent care in people's homes. We're doing RPM technologies at home. We're doing hospital at home. We're trying to meet patients where they are to expand healthcare as much as we can. But that critical need of actually building facilities to deliver Apex healthcare, that's fine. That's being done right now, and I couldn't be more excited.
Great. Well said, all of you. And your themes, interesting, are all similar. It's about making sure the patient can get to us and we can get them the care they need. So thank you very much for the time today. Seth, it's been a pleasure doing this with you now.
Thanks, Annette. And I just want to thank the panel as well. We're so lucky, one, to live in Orange County, but two, to have all these people leading our healthcare organizations and really making this a great place to live and a great place to get healthcare when you need it. So back, we're going to hear from Laura Magnuson from Cigna, who will discuss the mental health challenges facing us today, especially our youth as we navigate COVID. And then we'll also have Dr. Adam Solomon, Chief Medical Officer of Memorial Care Medical Group and Greater Newport Physicians IPA, provide an update on some of their big news, including a discussion about new and exciting telehealth innovations they're using to improve ease and access to care for our community. Stay with us.
By nature, my husband has always been an optimist.
Unfortunately, we're not getting back the results.
When he was diagnosed with a rare lymphoma, he still said, "It'll be okay. I got this." But after the second round of treatments was unsuccessful, it got harder for him to believe that cancer wouldn't win. That changed the day he visited UCI Health, home of the first and only adult bone marrow transplant program in Orange County. His doctor sat with us, and together we mapped out the exact course of action they were going to take. With UCI Health's groundbreaking research and an expert team of specialists, they gave him the customized treatment that others couldn't. When this all started, my husband had a plan to be back home in time for my birthday. And thanks to UCI Health, I got the best gift I could ever ask for.
At Memorial Care, you can get urgent care anytime, anywhere. With virtual urgent care, you can be seen and treated by a provider on demand through video visits on your computer or camera-enabled smartphone. And if you prefer to receive in-person care, we also have 12 conveniently located urgent care centers. When you need care now, we're here, without the wait. Get urgent care anytime, anywhere at Memorial Care.
When you think of growth, what do you think of? 5-year plans and upward pointing arrows? Cash flow and competitors? Projections and paperwork? Or do you think about your people? Their growth, their health, like Erica, whose daughter just got braces.
Hey, Mom, I got blue ones.
Oops. Or Jim, who's going to need a mental health day tomorrow.
You want a little sippy cup?
Or Kenzie, who has physical therapy on Tuesday. Ow! I'm not saying bottom lines aren't important, but don't just pay for a health plan. Invest in a growth plan. Cigna, your new growth plan.
Welcome back to our program, to a healthier South Orange County in 2022. Once again, we'd like to thank our sponsors for today's show. Our title sponsor, City of Hope, our program sponsors, Cigna, Memorial Care, and UCI Health, and our supporting sponsor, Providence Mission Hospital. Now, back to our moderators, the President of City of Hope, Orange County, Annette Walker, and the Chief Executive of Providence Mission Hospital, Seth Teagan.
Thanks, Mike, and welcome back to the program, everyone. Annette and I are pleased to welcome Dr. Adam Solomon, the Chief Medical Officer of Memorial Care Medical Group and Greater Newport Physicians IPA, Laura Magnuson, behavior clinician specializing in mental health issues with Cigna. Thank you both for joining us today. I know Annette's going to start us with a question.
Yeah, Dr. Solomon, I'm really excited to hear what's going on in Memorial Care. I had the opportunity to work for Memorial Care many years ago. But you've grown quite a lot. You're a large not-for-profit integrated health system with 225 outpatient sites, both primary care, specialty care, telemedicine, urgent care, imaging. The list goes on and on. I understand that, you've really been focusing on improving quality and access and accessibility through some innovative models. And love to hear about how you're using some of those to help improve the health of Memorial Care patients and the community, and especially how they might have been helpful during the pandemic.
Sure, thank you, Ned. And first, I'd really like to thank the South Orange County Economic Coalition for inviting me to talk today. You had mentioned a lot about us. Let me start by digging into something that you said last. You mentioned the innovative care models. And historically, Memorial Care had been a hospital-based system. We have 4 hospitals, including our 2 up in Long Beach, which also includes Miller's Women's and Children's Hospital, one of only 8 freestanding children's hospitals in California. Orange Coast Medical Center in Fountain Valley, and of course, the beautiful Saddleback Medical Center in Laguna Hills. But around the time of the Affordable Care Act being passed in 2010, we made a strategic decision that it's pretty much unheard of for a hospital system to do, and that was to take care that doesn't need to be provided in a hospital and to move it out into the community. And that would make it much more accessible and affordable. And that's where those 225 community-based outpatient centers and other things that you mentioned come into play. And with that move, we were better able to start digging into these value-based models where we take on responsibility for supporting the long-term health of a population. And these come under names like HMO, managed care, Medicare Advantage, but also direct-to-employer contracting and accountable care organizations. And these are where we get the data either because we've provided the care or that data and information gets given to us from the health plans that would be paying some of those claims. So we're able to aggregate all of that information together to give us some insight into what's going on with our population. And that enables us to do some really innovative things. And I want to give you a couple of examples. One, it was at the start of the pandemic where no one knew what was going to happen. Everyone was isolating at home. And we recognized that we had a lot of seniors that were at high risk. And we were able to use that data to identify those that had chronic conditions that put them at the highest risk. And we started calling them just to check in and see, how are you doing? And they were so thankful. We found patients that were at home running out of food, running out of medications because they were too scared to leave the house to go to the grocery store or the pharmacy. So we could connect them with home delivery of groceries or home delivery of medications and other places that they can call to get care if they needed it. And that was very comforting to them. And even now, by having this broad community-based network, that decreases the need for patients to go to the hospital to get care. And our hospitals right now are inundated with patients that either have COVID or that have been putting off their chronic conditions and are much more ill than would normally occur. And so this prevents those additional patients having to go there. And we do have these care teams that are available to coordinate care and to guide people through all the complexities of healthcare. And so that's how these models of care are helping to ensure the health of Memorial Care patients.
Oh, that's a great answer, Adam, and thank you for sharing all that. I'm going to switch over here to Laura, our other guest. Let's talk a little bit about the impact COVID's had on our mental health. Just when we thought we were out of the woods here, Omicron hits. And now I've even heard rumblings this past week, there's yet another variant that's presenting itself in the UK. So seemingly this is far from over, but what is this doing to our mental health?
Sure. So if you feel like you've been on this emotional roller coaster, right, you're definitely not alone. Just like you mentioned, it feels like you can't even keep up with everything that's happening, right? You know, it's now we're also talking about different masks that we should be wearing. There's conversations about kids in schools. You know, it's constantly coming at us, and things are changing pretty rapidly, right? And so our feelings, of course, are all over the board throughout the day and having different reactions to all these pieces of information that are coming at us. So it's just only a typical response that we are going to be really exhausted, right? And we're exhausted with this pandemic, right? We all want it to be over. Just when we think we're getting out of the clear and things might start to return a little bit to normal, something else happens, right? A new wave comes. So this is really taking a toll on our emotional health. And we're starting to see several new reports that are showing really the outcomes and the impact it's having on our mental health. And so I can share with you that people with signs of anxiety and depression have tripled since before the pandemic. we're seeing a 10 to 20% increase in antidepressant prescriptions. And we also know that loneliness and isolation prevalence is really skyrocketing. And just when we think about what does that mean, if we take just this concept of loneliness, when we feel lonely, we generally feel more stressed. We might be sleeping, but we're not feeling rested. We might be stopping taking care of ourselves, taking care of, our hygiene. Our outlook on life might be shifting a little bit, might be a little bit more negative. So of course, that's when we start to see these signs of anxiety or depression. Many individuals are turning to substance use, so drugs or alcohol. In 2020, we had a record number of overdoses as well. So, there's many ways that we're really seeing this mental health struggle play out. There is good news, right? I don't want to sound like Debbie Downer here. The good news is that I think that this pandemic, part of the silver lining is that we're talking about mental health, right? This is something we're seeing stigma start to slowly get chipped away at. There are more individuals that are reaching out for care at Cigna, where you're seeing our utilization go up. So those are all great markers that we're taking care of our mental health, but we're all really being impacted through this duration of this pandemic.
Yeah, it's a crazy time, Laura, and thank you for your answer. I think all of us, just as adults living in society, are trying to cope with all of these things and the continued pandemic rolling along. But I think for a lot of us, especially if you have families or young children or grandchildren that you're around, the impact on kids is something we talk about a lot. So how do you think children are adjusting to this new normal, that being isolated, they're masking everywhere they go, which certainly isn't how all of us grew up. They're being asked to stay socially distanced. Certainly sports are being impacted in high schools and middle schools across the country. How do you think this is impacting kids, and what can we be doing as parents or grandparents maybe to help assist them along the way?
Sure. So, it's definitely, as you mentioned, Seth, really having an impact on our kids. The Surgeon General in December just released this advisory calling for, a crisis in youth mental health. We are seeing more youth, report to emergency rooms due to suicidal ideation. And just to your point, right, a lot of this has to do with that social isolation and the support systems that our kids really got torn away from. So if you think that, that they were doing school virtually, they didn't have their friends that they were able to talk with every day in a normal setting. They weren't able to go out to recess if they're younger. Maybe those extracurricular activities got taken away, and that's where they were really thriving. So, a lot of pieces of their support system got torn away during this pandemic. And so, as parents and as educators, as supporters, we need to recognize that they've been missing out on all of these social interactions. And I can tell you, I'm married to an educator, right? And so our education system is overwhelmed with kids that are now returning to schools who have missed that social interaction. And teachers are really having to try to come in and provide a lot of this emotional support that these kids have been missing out on. And so as parents, what can we do about this, right? I think we continue to have these conversations. Our kids and our adolescents, they're connecting now virtually than they ever did before. This is the way that they're connecting. But we need to have conversations with them about what's healthy when we talk about social media. Because, if we can kind of think back to when we were teenagers, this is a time that we're trying to identify ourselves, right? And maybe we're experimenting with who we are. Well, now these teenagers, the only way they can do that oftentimes is through social media or some kind of virtual outlet. So as parents, as educators, we need to, come together and talk about what are the risks related to social media, and make sure that we're having conversations about how we're feeling and that it's okay that we're having this anxiety. I have 2 school-age children, and I can tell you, they have both responded differently. They are involved in extracurricular activities. One of my children has anxiety if not everybody there is wearing a mask, where the other doesn't seem to be quite as impacted, right? So it's taking these individual approaches, talking about what's going on, letting them know that their feelings are okay, and trying to talk about, okay, so how can we develop some coping skills? What can we do to try to get through this time? And we're going to get through it, right? And while we don't know what the future really looks like, right, we're here as a family, and we're going to get through this. And I understand what you're feeling because I feel it sometimes too, right? So yeah, great question. It's going to be interesting to see how things continue to evolve, I think, in this realm as well, and the long-term impacts it has on our children.
Thanks a lot, Laura. Great answers, and I think some great guidance for all of us. Annette, I'm going to turn it back over to you.
Thank you, Seth. Dr. Solomon, telehealth, definitely. I mean, we had these capabilities before the pandemic, but clearly both patients and providers learned really how to use it well during the pandemic. Can you talk about how you think this is going to permanently change the healthcare landscape?
Yeah, it's a great question. As you mentioned, the use of telehealth before COVID was very rare. But then after COVID hit, within just a couple of weeks, our providers embraced the new technology, and more than half of our visits all of a sudden were telehealth visits. And we've continued to expand the availability of both on-demand as well as scheduled virtual visits, to the point that 2 months ago, we've launched a 24/7 virtual urgent care. So it doesn't matter day or night. If you're not feeling well, you don't need to go to the emergency department. You don't need to suffer through the night wondering and waiting for an appointment if you can get in. We have a provider that's able to see you virtually and address your needs. And we've enhanced some of the capabilities of the virtual care through a partnership with TytoCare. This is a device that you have in your home. It's an app along with some hardware that has attachments. So it's connected to your cell phone through Bluetooth. It has a stethoscope type device that can capture heart sounds and lung sounds, a little otoscope to look into the ear, a tongue depressor to look into the throat. So the virtual care provider can see and hear what's going on with the patient, and that is able to expand the scope of the kinds of things that we can treat over video and makes things more accessible. But the technology is beyond just video visits, and so that's continuing to expand. Something else that we started offering during the pandemic was a product called Baby Scripts. And this is it's an app along with a blood pressure cuff, and it's for pregnant moms to be able to do some measurements and monitoring of their pregnancy and their health from home. If any of those measurements are out of whack, if they're moving away from where they should be, we'll be notified, and then we can outreach to the mom to check in, see if she needs to come in and get seen or address anything going on. But it also has information that she can use on what to expect during your pregnancy, answers to common questions that an expectant mom might have, virtual tours of the location where you're going to go and to deliver, and that kind of information. And we started offering this in the fall of 2021. We already have over 2,250 moms that are enrolled and being supported by that product. Something similar that we offered with COVID is called Twistle. And this is an app that has the ability to capture symptoms that a person is experiencing. So if they had COVID, they don't necessarily need to be in the hospital, but then people get worried, symptoms are getting worse. And then instead of having them to keep calling or to keep checking in and getting seen, this will monitor them. So if they have anything, again, that starts to become concerning, we can then notify them, hey, we saw this was happening, what can we do, and how are you doing? And again, help to direct them to the right kind of care. In addition, we have a website chat bot. So if you were to go to memorialcare.org, down in the bottom right corner, there's a little chat bot that's there. But in this case, you can think of it more like an AI concierge almost. Yes, it can answer questions about hours or locations, and that takes away some of that waiting for people calling in on the phone. But if you have symptoms, you can start to put in what the symptoms are, and it can help connect you with the right type of care to assess your needs, and even help you to schedule an appointment with the urgent care, with the PCP. And if it's a minor problem, it will continue to go through those questions and can then summarize that information, hand it off to a provider who can review it, make a recommendation, diagnosis, prescribe medications, notify you. And so no one has to talk to anyone. No one has to wait on the phone. No one seems to talk on the phone anymore. It's all about texting. And people can get their care treated electronically like that. People can get access to all of these services through the Memorial Care MyChart app, just as well as from the website. And so I can go on and on, but I did want to mention one of the things, because we were talking about mental health. One of the other things that we offered, because mental health was becoming such a big issue with the pandemic, is a tool called SilverCloud. And this is an online tool with a series of modules that people can either self-guide through, or they can have a coach that will help lead them through the different modules that address things like depression or anxiety, perinatal well-being, adolescent anxiety, insomnia. These have been clinically shown to improve those symptoms compared to other types of care. And because things were so prevalent going on at the time during the pandemic, we offered this for free to the community. We had over 2,300 community members sign up for this app. So we're very, very proud of that.
Those are all really pretty cool. I find some intriguing, but I applaud you, because I know if I can avoid ever have to going in person ever again, I'm going to try real hard. But I'm going to keep that 24-hour line, because I don't know about the rest of you, because my kids waited till the doctor's office closed, and at 5:05 is when they figure out they were sick, and then you're like, oh my God, what do I do? So those are great. Those are some really great innovations. And Angie mentioned mental health, and that's an area that I know from what I've read, and Laura, I'd like you to comment on. The use of telemedicine in mental health has kind of exploded also. Can you elaborate a little bit on that?
Sure, yes. It definitely has exploded. And you know, we're seeing so many different virtual providers, right, that are coming to us. And I think that that's, again, kind of part of the silver lining related to the pandemic. You know, maybe someone was reluctant to go and get care because maybe they didn't want to sit in traffic for a while. Maybe they were concerned, maybe they live in a small town and they were afraid of running into somebody that they might have known at the office. Maybe they were just scared of getting behavioral health care, you know, at all. And so I think that this virtual component really takes away some of those barriers that we have seen. And what we're seeing at Cigna is that our members are really adopting this modality of care. And while we have seen dips as far as when the pandemic first started, we saw, you know, medical utilization as well as behavioral utilization go up. We've seen that medical utilization drop back down, but we're not seeing that on the behavioral side. So it appears that our members are really embracing, you know, this new technology and ease of access, and that it's not going to go away. So we don't have plans, you know, to have this formatting go away anytime soon. And I really see this as a plus. When we've talked to providers even that offer this care as well, what they're finding is they really are enjoying this as well. They're having, you know, fewer no-shows. They feel like their clients are able to open up, you know, where before maybe they thought that could have been a barrier. Like, I don't know if I'm going to be able to develop this rapport virtually. That's not what they're finding. They're finding that, you know, their clients are actually feeling more comfortable and they can talk about what their issues really are. So again, you know, right now you can have a meeting with a behavioral health coach, or, you know, you can text with a therapist. Maybe even talking to somebody is a little bit overwhelming, but texting sounds okay. So really kind of whatever format that you feel comfortable in, there is a resource that's available to meet that need. And I really think that's going to be huge moving forward in getting all of the needs addressed, because we know that there was a shortage of behavioral health providers even before the pandemic. And so this is another way to really ease that access and get folks connected to the care that they need.
Yeah, well, I want to thank the payers for helping support that happening. I know as an employer, we've made many, even more resources available to our employees. And this is the most common method of distribution has been through telehealth in the last couple months. I'm going to turn it back over to Seth right now. Seth, you have some questions?
Yeah, just to stay in this kind of same lane with Laura here for another minute. You talk about the telehealth resources that are out there. What are some of the other resources that might be available to folks out in our community, or even daily activities that people can take part in that can help improve their mental health and wellness?
Sure. So there really are a variety of resources. And oftentimes, you know, when individuals need help, they might feel overwhelmed. So I would say, you know, first, a reminder that many individuals have access to an employee assistance program. And so these are sessions that have no cost for you and your entire household. And I think oftentimes we forget that. So just a reminder to utilize your EAP, as that is oftentimes a great resource. If you really don't know where to start either, I always say the National Suicide Prevention Lifeline is a great resource. Their number is 1-800-273-8255, open to everyone, and they can definitely direct you to resources available within your community. I can also share a website, whether you have Cigna insurance or not, cigna.com/coronavirus. There's many different articles, podcasts, even some guided meditation that's available there, as well as even resources to local food banks in your community. So, you know, it's really about if you need help, making sure that you're asking for help, because there's so many different resources that really are available. When we talk about different activities that we can do or things that we can do, you know, at an early stage to kind of improve our mental health or try to, you know, look at some of those self-care activities. I would say the first is getting outside, getting that fresh air. You know, exercise has been found to really boost mental health as well. Finding something that you enjoy. So whether that be yoga, meditation, riding your bike, whatever kind of hobby that you find enjoyable, engaging in that. Getting regular sleep. And of course, that's easier said than done. And so if you are having difficulty sleeping, really looking at what does your sleep hygiene look like? What are you doing before you try to go to bed and get restful sleep? I know that I found early on in the pandemic, I could not watch the news before I went to bed, or I wasn't going to sleep. So looking at, are you getting rid of some of that blue light before you go to sleep? Are you doing things to try to relax your body? And of course, looking at things like alcohol and caffeine, as that can impact your sleep as well. Connecting with others is really important as we talk about this idea of loneliness and how it's really impacting our health as well. So figuring out whatever you feel safe with, maybe it's connecting virtually, but making sure you maintain those relationships that you really find beneficial. And volunteering. So volunteering has really been found to boost the person that's volunteering's mental health, right? And so again, you can do that in whatever safe way that you feel fits your best need, whether that means you're writing letters to seniors in a home, or you're, you know, going in person to a food bank to donate a couple hours of your time. That has really been found to be successful in boosting your mental health. And of course, we always want to recommend, you know, all of these self-care pieces are really important, and we want to work them into our daily schedule. But if you feel overwhelmed, you feel like none of these things are happening, make sure that you're reaching out for that professional help. Because as we mentioned before, there's a variety of different ways you can now connect to different behavioral health resources in the community.
Thanks, Laura. Just great comments, great guidance there on some different things that we can all be doing. Dr. Solomon, any other closing comments you'd like to make on this topic?
Sure thing. Thank you so much for having me today. But I wanted to share that we're very excited to report that this May, Memorial Care Saddleback Medical Center is going to be breaking ground on the first Women's Health Pavilion in South Orange County that supports the health and wellness of all women from adolescence to childbearing to senior. The anticipated opening will be in 2023. This will be a 3-story, 40,000 square foot pavilion where services that normally would have been spread about town are now going to be located in one place. This will have a comprehensive breast center, women's specialty center, mental wellness support, and more, all in a calming, comforting environment. We're also continuing to expand our outpatient services in the community. That includes convenient, high-quality imaging services and physical therapy, which includes our newly opened California Rehabilitation and Sports Therapy Center in Rancho Santa Margarita. Lastly, Memorial Care physicians, staff, nurses have all been volunteering for the last year, providing free community vaccines throughout Orange County and LA County. We've administered over 185,000 doses of vaccine. I think that makes our volume second only to the county of Orange. And so this has been in school districts, cities, community centers. So today I would like to ask for everyone's help in continuing to encourage everyone 5 and up to get vaccinated. And if it's been over 5 months since your last vaccination, to get boosted, especially if you're a senior and have any chronic health conditions. We're all in this together and really appreciate your support. Thank you.
Thank you both. I'll turn it back over to you, Annette.
Yeah, I just want to say thank you to both of you for joining us today. And I'd also like to thank Dr. Kim, Dr. Kenny, and Dr. Schubel, who were on the earlier segment. And Seth, it's been a pleasure doing this with you. I hope we can see each other in person. Would really enjoy that, but it's been great to be part of this discussion today. So thank you.
Well, thank you, Annette. And it's been my pleasure as well. We're going to have to get back together for lunch. I know we got to do that kind of when it seemed like the pandemic was settling down, whatever version of the pandemic we were in then. And of course, for all of you tuning in today, Annette and I are threatening to put together our own podcast.
Yeah.
So we can stay connected and keep.
But I think we'll hire Brian to do it because he's very.
Yeah, he's done a great job. We've had great guests today. 2022 shaping up to be a great year for the South Orange County Economic Coalition. Of course, we're looking forward to having a buddy of mine, Dr. Chris Schwartz, a great guy, one of the only people I know that can make finance interesting and funny to talk about. So he's going to be with us. He's a finance professor with UCI and give the 2022 South Orange County Economic Report next month. So you won't want to miss that. Good afternoon, everyone, and thanks again for joining us today.